well, I still call it, but former CMO here at KU, Dr. Lee Norman, the secretary at KDHE. So first, Nate, before we go into all that, how are we doing on the numbers today?
Yeah, today it's pretty steady from where it's been in recent times. Have a total of 114 patients. 67 of those are active COVID infections, 47 of those not active infection out of isolation for that. And of the active patients, 21 in the ICU, 10 on the ventilator.
So our total of acute and recovering then, how much is that, Nate?
It's 114.
Okay, so that's kind of where we've been for the last couple of weeks. And so we're taking that as a good sign because we're really, you got to argue that Christmas was on the 25th, today is the 19th. It's been like 23 days, a little more than 3 weeks since Christmas. We haven't seen the huge surge that we were a little bit nervous about so far.
Yeah, thank goodness, and hopefully it stays steady, or, maybe less would be much better.
We would sure like that, especially as we get patients vaccinated who live in nursing homes. I think that would be the best thing.
That's right.
Hayes numbers?
Do you have the numbers from Hayes?
Oh, yeah. Hayes. So Hayes has a total of 18 inpatients and 2 in the ICU. So fairly steady there as well. I think slightly down.
They were 22, I think, at the end of last week, so down to 18, so that's good as well. So both Western Kansas, Kansas City, at least from those two samples, are down just a little bit. Mayor Lucas, how does Kansas City feel? And welcome to our program this morning.
Well, it is good to be back, and kind of late Happy New Year to all of you. I know we talked late last year. Much of what was just discussed, we are happy that we didn't see the same volume of a spike that we feared back around mid-November into Thanksgiving. I know when we had talked before. However, we still have a steady number of cases, something that we're a little bit concerned about. And don't get me wrong, I am so excited about the Chiefs playoff run. But, house parties, a lot of the things that we actually thought could be concerns during the holiday season come in this kind of holiday season part 2. So in our messaging, we're reminding people of masks, social distancing, all the things we needed before. Even with the vaccine news, it will still be a while. And so we hope people are just heeding that good public health advice.
That's right. And as we all know, keep Patrick Mahomes safe, wear your darn mask, and he's got to heal anyway. Lee Norman.
Exactly right.
Lee Norman, how are things going for the state of Kansas?
The statewide trend is pretty much what you described, Steve. And as you know, I'm on calls every week with hospitals, everything from small critical access hospitals up to large tertiary and quaternary care facilities. And the numbers are definitely tracking down. And we've been, matter of fact, our case per capita compared to the United States is one of the best in the nation, which is kind of interesting because the coasts and the South are really upticking in their number of cases. So we've been a little bit of an island in that regard. But as Mayor Lucas said, and we are kind of holding our breath because it is a plateauing off, but it's a higher plateau than we've been at before. So we've got some struggles ahead. And the vaccine won't be here in sufficient quantities quite yet to stem that tide. But as you pointed out, getting it in long-term care facilities is going to be one of the very pivotal things since that is such a vulnerable population.
Indeed. So what is the status of vaccination, and when do you think Kansas might be able to move into phase 2, if we can be so bold?
Yeah, we'll find out this week. We're pushing out. Yesterday we did all of our allocations. It'll go out in 2 shipments this week, both the first dose and the second dose, of course, for those people needing their second dose. And then we'll have a good idea, I think, by the end of the week when we can move the whole state into phase 2. And quite a few of the counties are actually pretty much there already. So just watch for that later in the week. There'll be very formal announcements so that we can sync everybody up. The counties have been really good. Some used their excess vaccine and pushed it to other counties that were having more struggles in phase 1. But I think we're getting very close. We'll know by the end of the week on that.
Mayor, one of the biggest things that is important is to get the vaccine into vulnerable populations. And yesterday we celebrated Martin Luther King, and certainly did in my home. And I wonder, from your standpoint, how do we get into vulnerable populations to make sure that they get the vaccine and don't feel unsafe about the vaccine?
Well, there have been a few things we're doing in Kansas City. First, it is making sure that we're working with a lot of our federally qualified health centers. And so not just the University of Kansas Hospital, but there are a number of facilities that have for decades provided indigent care, in the classic parlance, to a number of populations, making sure we're reaching out in different languages, making sure we're working through a number of our community clinics, our smaller healthcare facilities has been a big part of what we're doing. As Dr. Norman notes, here actually on the Missouri side too, working with our health departments when we get our vaccination doses, making sure that we're really putting priority on those vulnerable populations, the folks and the groups that aren't calling their physician's office necessarily to try to get the vaccine when their time comes. But another part of it is really educational. It is letting people know that it is here, it is safe, and that as it becomes available, you should take on your opportunity to receive the vaccine. In different polling numbers, we've continued to see that in certain groups, there are some who have some reticence. And so we continue to message that every step of the way, but really working with everyone. Another thing I also want to help or thank hospital groups for is that we have in recent weeks, both through the Mid-America Regional Council and both the Kansas City government, really reached out to more hospital groups to make sure that as vaccines are coming in, we're being united in what that communication is in trying to make sure we reach all groups.
Yeah, I think just a special shout out. I know that Mark Steele and the team at Truman Medical Center have done a great job at reaching into vulnerable populations, which is part of their mission. I think they did a great job around testing, and they're doing a great job. Mark is on the call with us tomorrow on our media presentation because we have our chief medical officers back on this program tomorrow. That'll be a great discussion for everyone. Do you all think that the Biden administration was talked about a little more of a federal and centralized approach to vaccine administration? How do you think that's going to affect us? Dr. Norman.
Yeah, we are very dependent, obviously, because the federal government is the only source of vaccine. I was on a series of rather frustrating calls last week, up to and including General Gustav Perna, who is the Chief Operating Officer for Operation Warp Speed. And I tell you, it's been a struggle because the information we've gotten has been inconsistent. The promises of vaccine quantities have not come through. It was kind of a further headache when we heard that this kind of reserve from Secretary Azar, the reserve of vaccine, really was kind of a vaporware reserve. It really didn't exist. We will see a little bit of an increase, I think, because they were holding back a paltry 1 or 2% for kind of emergency use, and they've decided to add that on. But you know, when you think about it, on a per capita basis, we're both struggling on, and I, of course, communicate with Dr. Randall Williams, my counterpart on the Missouri side. We work very closely together, but it's been a struggle. It's all the supply side. We push it right out and administer it as quickly as we can, but it's just a trickling supply coming in that has been a source of frustration. And, you know, we don't hold it at the state. I've gotten people that I've heard some level of criticism toward me about hoarding it or something, and we don't keep any of the vaccine at the level of state. It goes out to we have about 300 sites right now that are vaccinating, and we'll probably double or triple that as we get more vaccine coming in the door. We're enrolling those other providers now. So
there's no secret stash in your office?
No, I have no black market of vaccine going on, sadly.
Well, we knew the state-faced budget cuts. We were afraid maybe that was part of the deal, but I guess it does sound like that's true. We'll have to dispel that.
No, it's going out the door.
Mayor Lucas, you mentioned all the federally qualified health centers in the city, which I think have done just a great job at trying to do this. And your team has done an amazing job working with so many different parts of the organization. And I'm just going to say Arrowhead Stadium, which has not turned out to be an outbreak and set the model for really all the National Football League. What do you see as happening in the next phase of this epidemic about trying to get things in people's arms? You see drive-by clinics? Do you see, I mean, how do you see this going on?
Well, first of all, Dr. Norman won't give himself enough credit on it. It has been a, shall I say, frustrating set of months during this pandemic when we have communicated sometimes with different voices and theories coming from our friends at the White House and from federal directives. I look forward to having some clear direction and hopefully ideas on how we're getting supply and certain numbers coming from the administration starting on Wednesday. We're very hopeful for that here in Kansas City because, a lot of health directors, both Dr. Norman in Kansas, Dr. Williams here in Missouri, and certainly all of our county city health directors have worked hard to try to come up with rules while we're hearing sometimes different viewpoints from above. I will say this, though, in terms of what our kind of vaccine theories and rollout look like, there are a few different things that we're trying to do. One is to make sure that there are significant low barriers to entry. So the idea that almost like school immunizations, something that health departments have some experience with, you can go to the health department, you can receive a few different types of services, working to ensure that we have that, working to make sure that we do have the volume. When you look at, even in our testing apparatus, sometimes if we said we're having testing at one facility in Kansas City, you would see very long lines, but nobody's somewhere else. So making sure that we're looking throughout the city. And I'll go back to something I said before, regional cooperation, regionalism in how we're working this out. A lot of us are elected by lines, at least I am, but others really don't see it the same way. That's why you've seen some shared resources on signups, like in Jackson County and Kansas City. You've seen shared resources in how we're looking to even message our rollout. And you've seen consistency continuing in our public health orders. Sometimes that gets us some critiques or not. But those are the sorts of things that will probably continue through this pandemic, at least for the next 6 to 9 months.
Yeah, I think that, you all have done a great job just to say our regional approach with the core four, or the things between, Lee and I had a conversation before about what happens for us. 30 to 40% of our patients come from Missouri. So that means we ought to be vaccinating those folks. Does that mean we're going to be vaccinating Missourians? And Lee, I think your approach last time was vaccinate whoever you can. I don't care where they live. And I'm assuming that's still the plan.
That is still the plan. And especially when it's employer-based, there's the virus doesn't give a hoot about the state line. And if the employers have or hospitals in this case, have a vaccine and they've got employees, vaccinate them. And now we also encourage the same thing across counties. We have 105 counties in Kansas, and we allocate to local health departments by counties. But we encourage people, even if they cross the border, to be vaccinated. And there's been a little parochialism about that, but we're trying to encourage people to not think that way.
Yeah, I know. I think it is incredibly important that we have a stronger response coming out of DC to help us know what the rules are around that, even down to the point, it was a little difficult last week when they said, okay, we're going to push out all the vaccine. And then the current administration said, yep, we're going to push out all the vaccine. And they said, oh, wait a minute, we already did. I mean, that kind of threw everybody's plans on Friday afternoon up in the air, and I think that is incredibly frustrating for those of us who work in this space. So hopefully we'll have a little more consistent message and source of information, right down to wearing a mask, because we believe in wearing the mask because the rules of infection control always keep you safe. Hey, let's see if there are questions from reporters. I got 1,000 questions I'd like to ask these guys, but I probably ought to let the reporters ask a few. Okay, Jill, you've got some, I think.
I have some from the community. We'll start there, and then if a reporter
hi.
wants...
This is Ellen McNamara. I'm sorry about that.
Hey, Ellen. Welcome aboard.
Hi.
I know we don't hear you, Cody, Taylor. You're always there for us.
Well, I think my 2-year-old's crying right now, so I apologize about
That's
that,
the best.
too.
That's the best.
Okay. All right. Just 1 second here. So you guys talked a little...
That's how we felt last week, Ellen. Don't feel bad. That's exactly what the response was on Friday afternoon, right there. That was it.
Yes, it was. I'm going to run outside really quick. Okay, so the administration, you guys obviously talked a little bit about that and the change of kind of the guard. Are there going to be just completely new people that you are going to have to communicate now? Do you even know, is Parna still going to be a part of this? And I'm assuming you're kind of, optimistic that there is kind of a plan moving forward. But what, logistically, are you going to be dealing with a whole new set of people starting Wednesday?
Lee Norman, I think that's right up your alley.
Well, General Perna thinks he's going to continue in his same role with Operation Warp Speed. And for all the warts that Warp Speed has, and there's quite a few, he has been at least a consistent, straight-up guy to deal with. I think he's going to remain on. There's going to be a lot of appointees throughout the CDC and HHS at the higher ranks within the organizations, but the people we deal with at both the HHS, meaning the regional offices, and CDC are not political appointees and will stay in their place. Now, that's about policies and how those will be changed or applied. We have not gotten direction from the White House or HHS of any changes at this point in time.
Mayor, how does that affect Kansas City? Because I got to believe you guys are in contact with federal and local officials all the time and state officials.
You know, we are, and typically our interactions will come either through, at least through the summer, the White House has an office of state and local affairs. Often they would set up calls with mayors about our city size, maybe a little bit larger in our region, to try to get messages out. Later in the administration, that was typically a call with Dr. Deborah Birx, who I understand is planning to retire at the end of this administration. And so we expect to have new personnel. However, we do expect that new personnel to reach out to us fairly regularly. Our congressional delegations, Republicans and Democrats that represent us here in Kansas City, have already kind of started some of that communication and contact. So we're expecting a fairly seamless transition. And as Ellen noted, in some ways we're expecting an enhancement, or at least as she asked, an enhancement sometimes in the information. I'll give you one vignette in terms of what we were looking for. Way back in the spring, there was some discussion on masks. And I remember myself, I think it was the mayor of Milwaukee and the mayor of Tulsa. And we said, well, this is wonderful. Can the White House give us official advice on that so we can run out and say it? And they said, not yet. I hope, because consistent messaging from folks of all groups and political persuasions is really important in stopping the spread of this virus, that we get more of that consistency now, because our community needs it.
Yeah, totally. And I just say mask wearing, there is absolutely no question. There is no controversy. The controversy is a political one. It is not a scientific, health, or medical controversy. Masking makes all the darn difference. And we prove it every day here inside the health system when we have multiple employees helping care for 100+ patients with COVID-19. And you know what? We don't see spread inside our health system. If we weren't masking, every single day would be a super spreader event here. It is not, and it's because masking works. And anybody who tells you that it's not true is not fair and is not grounded in reality. That's the truth. And if people contest that, I can't help you. You know, I just can't help people who want to stand up and lie about it all the time. Other questions, Jill?
This is Ellen again. My only
Hey, Ellen.
follow-up to that was, you know, you guys did talk on Friday how, I mean, honestly, it was a shocker, I think, to a lot of us that all of a sudden the stockpile didn't exist. Or the Wall Street Journal also reported on Friday that that basically the administration had waited more than 2 months to come up with this distribution plan, and that you know, there's all this money's been spent on the vaccine and development of the vaccine, but distribution has just been like this afterthought. Do you have a reaction to that, or are you guys just ready to move forward and, you know, when supply comes in, you just got to do the best that you can do. You just have to move forward. What are your thoughts on that?
Team, Mayor, thoughts? And then I'll turn to Lee.
I guess I have the camera, so I'll go ahead and say something. No, I am very gravely concerned with some of our rollout procedures. It is not unusual for the mayor's office to receive calls from some entities that have received vaccines and said, do you have an extra 1,000 people that we could vaccinate today? Do you have a lead on X or Y group? These have been calls that have come from hospitals. They've come from different community entities and groups, et cetera. We need to have more consistency in terms of what we're doing with excess vaccine. How do we make sure that we're accounting for things properly? That has to be more medical group, probably State Department of Public Health cooperation. It has been flawed in some ways. And so while I commend Dr. Williams. I commend the governor in terms of how we've been able to, I guess, get vaccine out, at least in sheer quantities. We need to do much better with what our plans are, because I do have concerns when I see that, oh, we have 200 extra vaccines. Can one of your departments come and get vaccinated today? That's not really the way we should be doing it. And I will say, Alan, that has probably happened more, at least on the Missouri side of the state line, than we would have liked over the last several weeks.
Lee Norman, I know it's frustrating.
Yeah, it is frustrating. We made everything's controversial, and where the vaccine goes is controversial. The allocation methodologies and but job one is not to waste any vaccine. To the mayor's point, you don't want to find yourself with something with a very limited shelf life, thawed out, reconstituted, and needing to get in people that go to waste. Unfortunately, we haven't seen much of that. I checked the numbers thinking this question might come up today. And in US-wide, of the 31.2 million doses that have been sent out, distributed from the Operation Warp Speed, 12.3 million are at least in the data system as having been administered. So that's just 39%. On average, in the United States, in terms of the number of doses that have gone out to those that have been administered. Now, granted, the data lags. Now, what we have given guidance is that when you get the vaccine, you immunize people, you gather all the information, and then catch up with the data so you can get people through, such as Mayor Lucas said, you don't want to have a mad scramble. We are up about 60% compared to the 39% in the United States. So I feel good that we've been outperforming average, but we still have a ways to go. It'll be helping a lot when we increase the number of providers. We've got a lot of providers that have registered to be vaccinating sites that we haven't even flipped the switch on yet because we don't have enough vaccine. So as we have more vaccine coming available, we'll turn on the switch with a whole bunch more, hundreds more of vaccinating sites.
All right, let's see what other questions we have out there.
We have questions for both the mayor and for Dr. Norman. I'll start with Dr. Norman since he has 10 minutes. All right, Kate wants to know, the CDC website states that people aged 50 to 64 are 30 times more likely to die from COVID-19 than 18 to 29-year-olds, yet the Kansas plan has everyone under age 65 in the same final phase 5. Why is that?
Well, first off, the age alone isn't what does it for the most part. If you go and look at the ACIP, the Advisory Committee on Immunization Practices, it's the coexisting medical comorbidities or conditions. So what we have done is, in following many other states and the CDC, had that age cut at 65, and then are going to quickly immunize people with underlying medical conditions before the general public of that age group. So it's age over 65 and other medical conditions.
Yeah, and I think, Nathan, that this is actually a really important point, because the truth is, as we get older, we tend to have more comorbid problems. So there's both an age variable, especially if you're really old, and then, like Norman and I, and then there's a, but then we do tend to have other healthcare problems.
Yeah, you do. You know, it's common to have more comorbidities. Those things add up. When these are analyzed, you have to sort of account for all those things separately. And so it isn't as simple as your age makes the biggest difference. There's a lot of factors that go into it. And even, you know, young people with severe medical conditions are really at high risk for even death from this disease. So it's not quite that straightforward.
And also, Mayor, it tends that in economic areas where there's more challenge, or minority communities where healthcare may not be as consistent, that even knowing what the comorbid diseases are make it harder, which puts people at greater risk, making it that much more important we reach into those communities to vaccinate.
That's exactly right. And that's why so much of our focus isn't actually in that same age basis as the question presents, but it really is looking at where do you have communities where you can measure the higher incidences of different comorbidities, where you have a higher incident of obesity, where you have a higher incidence of things that will lead to harsher outcomes from COVID-19. And that's been a big part of our medical strategy along the way. And so it isn't actually just as easy as bright lines, although I know everybody wants it to be that way because that's how we live life often. But it is instead saying, how can we make sure those who are extremely in need are able to get the vaccine earlier. I have, for example, she lives down in Texas, so hopefully this isn't a Missouri or Kansas controversy, but they've gotten to the point where some who've had very severe challenges from juvenile diabetes have been able to be vaccinated. My niece is one of them in the Texarkana area, and that's been important just given the threats and the risks that she's dealt with in life regardless of her age and what she'll continue to be dealing with. And that's what I think I've heard a lot of medical advice suggesting as well for us.
You know, it's interesting you raised that, so I'm going to turn to Lee. Lee, it feels like some states are a little further ahead on their vaccination program and are doing a lot more vaccine. One of my patients just went down to Texas to get a vaccine at UT Southwestern, where she was being evaluated for transplant. She's like 30 years old. Why is it so different from one state to another?
It shouldn't be in terms of the vaccine allocation, because that's done on a per capita basis, so that's just a number. Now, how she, in that instance, Steve, was prioritized can vary from state to state. And as you know, in Kansas, we prioritize solid organ and solid organ transplant and hematologic malignancy patients higher up, of course. But it does kind of baffle me a little bit. Why are all the snowbirds from New York and New Jersey, for example, down in Florida, getting vaccinated? Because they're included in the New York and New Jersey per capita. That's where they're listed as a resident. Ditto that for Arizona. And there'll be a lot of kind of messiness when, you know, snowbirds come back in the springtime, for example, and need their second vaccine. Again, I advocate for paying kind of a not overly great amount of attention to state borders. But when you think about the allocation method per capita, when a lot of people are having influx to different state, it just doesn't pencil out. Not sure how that works.
Yeah, and Leah, snowbird's a medical term?
Yeah, it is. That's exactly that. It's people that have snow on their head, like me.
That's it.
Kathy Quinn with KC Fox is on, or Fox KC rather, is on the line. Kathy, do you have a question?
Yes, there I am. So good morning, everybody.
Good morning.
There's been a lot of frustration with folks who have said that they're having problems with the sites to get for the online surveys. They're getting knocked off. We understand there's so many people that are trying to get on. What would you say to these folks?
Mayor Lucas.
You know, I would say, first of all, and it doesn't sound as positive as people would want, but keep trying. If the site is having issues, let's say today, make sure you try again tomorrow. The reality is, particularly given the volume that we have signing up, not everyone's going to get vaccinated this week. So not being able to get your sign up done, let's say Tuesday at 9 a.m., doesn't mean that we won't be able to, by Wednesday or Thursday, to be able to get that started. You know, we have worked hard to make sure we have the vaccine set up. You're seeing that now on the screen. And it is important for us as we talk about not wasting supplies of vaccines to be able to quickly be able to reach significant and large groups, but at the same time, make sure you keep trying. If you have any problem with that, either call your healthcare provider, no matter your jurisdiction, or certainly you can always call our public health department if you're, first of all, not on the internet, or alternatively, if you've had significant issues with getting signed up.
Dr.
Thank
Norman?
you, Mayor.
Dr. Norman, thoughts about that as well?
Yeah, we're doing things a little bit different on the Kansas side. We don't have a scheduling system at the level of the state. Matter of fact, most states don't have a statewide scheduling system. But I do want to point out to your audience that to use our website, which is appropriately named kansasvaccine.gov. That's one word. There you go. And because it's not on there yet, but we'll be on there this week. Will be every county. People can go hover over it and find all of the vaccinating sites and find the websites for things in vaccination sites in their own county and the like. But that kansasvaccine.gov has quite a lot of information. Goes back to the earlier question: what's this underlying medical condition that would make one qualified, quote unquote, for an earlier phase? For example, we have a dashboard on there that shows how many vaccines have been given, and I think that that's a pretty strong website, and it's going to get more robust as time goes on as we get deeper into this.
I think it's going to take all of us to get that vaccine done. We have 65,000 patients in our health system who are over 65 years of age, and we're going to message all of those folks this week about, hey, here's what we're going to do to help get things going. And so I think between, we've worked with Wyandotte, we've worked with Vibrant Health, our FQHC here in Wyandotte County, we've worked with Johnson County to try and determine how we can all work together to vaccinate, because it will take all of us to get this vaccination done. So I think, yes, you're going to get information from counties. I know Wyandotte or Johnson County has put out a survey. I know Wyandotte County is working on the same thing. So when you look at that it'll take all of us to do that. I was on a phone call yesterday with Patrick Salee, the CEO over at Vibrant, thinking, how can we work together if we're going to have mass vaccine clinics? Health system plans to be able to vaccinate at least 10,000 people a week. And I know Wyandotte has 3 mass vaccination sites. I know Johnson County is going to have a mass vaccination site. I know Advent and Olathe are all going to participate. So we are all going to be working together to get this done. So I think for our listening audience, you'll have multiple avenues to try and get vaccine as long as we get the vaccine in to be able to give it to you and get it into your arm. So part of it is we are wrestling with this transition. We're going to go from an administration that I think it's fair to say did a reasonably good job around Operation Warp Speed and vaccine development, but the distribution, the logistics around getting vaccine into people has perhaps not been as strong. We'll have to see how the new administration is going to handle that. Any thoughts around that, Dr. Norman or Mayor Lucas?
We haven't really gotten much from the new Biden administration yet in terms of any glimmer of increased production. So I don't know if it's on the production side or the distribution side. I think it's on the production side. We are ready to scale up, and as you pointed out, Stephen, through all those different avenues, we're able to scale up. We just don't have the vaccine, and we haven't heard from the Biden administration yet, really, on this.
Same.
I'm going to combine the Johnson County questions into one because I know, Dr. Norman, you're kind of running out of time. But there's a lot of questions around, did they get the appropriate amount per capita? Why aren't healthcare leaders there fully vaccinated? When can the second phase happen? And they want to know what you know about that.
Yeah, the Johnson County has always needed more vaccine, and 104 other counties have all needed more vaccine as well. And we've tried to be fair, and sometimes it's a matter of pushing 100 doses to a small county and 5,000 doses to a larger county like Johnson, Wyandotte, or Sedgwick. But even those amounts, when you have 25,000 people that are yet to be vaccinated, it just falls short, and we recognize that. But then if you say, well, let's just sequester all of it in those 3 largest counties or throw in Douglas and Shawnee as well, then we're depriving somebody else. So we've had a fairly even and very transparent, I might add, allocation methodology, but it's just fallen short because we don't have the amount of vaccine we need.
And then I have 2 short, quick questions possibly for you, if you could do them before you go. Gary wants to know, are we doing genomic sequencing?
Yes, we are. We're doing it in our state lab. We were originally doing only a small amount just to kind of keep an eye on where the viruses are coming from. But we are increasing that to 200 to 300 samples a week, looking for the B117 COVID-19 variant, and also there's a South African one. We haven't found any. I was talking to Dr. Williams, my Missouri counterpart, and they haven't found any of the B117. Of course, when you have 1,500 cases a day and you're testing and sequencing a couple hundred a week, that's a pretty small sample size. There's no question it's going to make it into the state. We've had a very homogeneous kind of gene sequencing thumbprint in the state of Kansas, but haven't found the 117 yet. We're going to increase it, and we're also going to have some help from the commercial labs as well to do more.
And final questions. Jackie wants to know what your thoughts are about the Coffee County nurses who didn't want to give the Moderna vaccine. And Sarah wants to know what you, Dr. Norman, and Mayor Lucas think about what you've learned so far in the pandemic that will help us moving forward.
Lee, the Moderna vaccine? The vaccine in Coffee County, Moderna vaccine in Coffee County question?
Yeah, let me take a whack at that. Very disappointed. I mean, if anything is fundamental to the beliefs of a public health department, it's the time-honored tradition of administering vaccines. And especially when you think about it, licensed independent practitioners like physicians and nurse practitioners and the like, when we order something to be done, we expect it to be done. Now, that's, of course, patients have the right to refuse. And I understand that they did take that additional step of bringing in contract nurses, but I, for the life of me, cannot understand why they've chosen to make the decisions they've made, and even going against their county health officers' opinions.
And what was their argument for not doing the Moderna vaccine in particular?
They weren't comfortable with it. They said that the tens of thousands of people in the study and the millions of doses we've given so far have not proven to them that it's safe enough for them to feel good about administering.
Okay, well, gosh, how do they ever give anybody any medication then? Because tens of thousands is a huge number compared to a lot of clinical trials. So you put yourself out there on that one, don't you?
Yep.
All right. Well, Dr. Norman, thank you for spending time with us. I know we still have Mayor Lucas for a few more minutes, so let's see what questions we have there. But you're welcome to stay, Lee. I'm always happy to pepper you.
I got to sign off. I've got some fires put out, believe it or not. Thank you, guys. Good to see you, Mayor. Mr. Mayor.
Have fun.
See you next Tuesday.
Okay.
All right, so again, what would the mayor have to say about what he's learned in terms of dealing with this pandemic that will be helpful to the city, and if we had future public health emergencies?
Oh, let's not invite any new ones yet.
Yeah, exactly. I think the first step that I've learned is probably cooperation. Working across jurisdictions with different medical groups has been essential to our response. And so that is a step one. I think that has particularly helped us at times when you don't know if you even have the resources necessary. I'll give you an example. Our health director was able to negotiate a bit of testing equipment that we didn't have in Kansas City, but our peers to the south in Cass County, so our friends in Harrisonville were able to send one up to us so we could help do enhanced testing for a city of 500,000 people. I mean, those are the sorts of things where you learn about cooperation, the resources that people may have. I think another core and basic type of thing that we all needed to realize again was trusting public health officials. I get asked all the time, Lucas, what do you think about a Chiefs parade? What do you think about any of these other things? And it has actually been helpful for me to say, I'm going to listen to public health advice. I'm going to listen to our medical experts before we're doing anything that a politician has just decided. And by the way, I've been asked a few times, a Chiefs parade in the classic sense as we knew it is highly unlikely, indeed won't happen, but there will be different ways that we come up with to try to celebrate, right? Those are the sorts of things that I think I have learned, making sure you listen first, that we become incredibly creative. And I think as we've seen from our ability to have conversations now, from our ability to, I think, safely reopen a number of schools, among other things, that we are learning how we can be creative, listening to advice, but also making sure we wear masks and keep people as safe as we can.
Yeah, that's really important. Thank you, Mayor. Okay, Jill.
Isaac has a question for the mayor. He says, once the most vulnerable are vaccinated, might it be possible that some restrictions fall away even before other people receive their vaccine? After all, the reason for the measures was to save hospital capacity. So,
Interesting question.
Very much so. I'd be intrigued by Dr. Steitz's views on it. I think
We've got him. Don't worry. Well, here's the deal that it would be great if we could say that everybody with concerning causes or risk factors has been vaccinated, whether age or comorbid diseases, Nathan. The reality is that even here in our health system, working with our team of healthcare folks, we're getting about a 65% uptake rate of the vaccine, which means a third of people are either vaccine hesitant and about 10% of people we know are vaccine deniers. And we know that's true nationally. That's just not a local statistic. So what it really means is even when you move to vulnerable populations, the idea we're going to get everybody vaccinated is probably an idea, but it's probably not reality. So I think, Greg Holland from Mayo Clinic was on our program last Friday, and he's like, look, you got to get 80% of people vaccinated before you think you're going to really have enough immunity out there that you can take off your masks and get back to full reopening. And I think that's right. I think the problem is that A, we don't know the vaccination yet actually prevents the transmission of disease. B, even if we think we will offer it to everybody, not everybody's going to take the vaccine. And so C, we have to be in this, to the mayor's earlier point, we have to be in this together. If we start playing our own individual ball, we'll go the way of a team that doesn't play together. And that means you're going to lose. And that is not the outcome we want.
Yeah. Yeah, and I would just add, these vulnerable populations, some of them are not going to get a good response, most likely, from the vaccine if they're giving it very early in a disease. Say, if you're somebody who has a cancer, has really intense chemotherapy, the odds that you're getting a really robust immune response if you give the vaccine right away during that chemotherapy, it's not good. So those patients, remember, there's always going to be patients like that are still vulnerable. Even if we're doing an amazing job of getting that vaccine out to everybody we can, there's still vulnerable people out there, and we all need to help protect them.
Yeah, so I think it's a while yet, but here's the deal. What you made another good point, which is one of the goals is to lessen the pressure on healthcare systems to take care of people. That's true, but the other goal is to not have excess death. And the reality is that it's your family and your friends and those who you may not even know have this underlying condition that will be at risk if we don't continue to follow the rules of infection control. Remember, we say it every time. The rules of infection control travel with you wherever you go, whenever you go, however you go. Those rules should be right there with you because those are the rules that keep you safe. And we've proven it again and again, as I say, here in our health system, by taking care of patients who have COVID. We don't have super spreader events here because we follow the rules of infection control, not because we got vaccinated, because we were safe before then and we were safe by the rules. And so, yeah, the rules are around a little longer. And that's why we really need to appreciate all those public health officials the mayor referenced just a bit ago. Yeah, Jill?
We do have an infectious disease question. A lot of people are wanting just to go over the symptoms. They're worried that, does it cause my medication to make me sick? Because I never got sick taking my medication until I took the shot. Is it going to cause me to have diarrhea? And is that a problem for older populations? People are just, can you just go over the side effects as you know them?
Yeah, I mean, it can be an array of side effects, I guess would be the way to say it. For me personally, I had a sore arm, and I was kind of fatigued for a day or two. That's sort of what I felt, but that's, there's certainly people out there that have more to deal with. Yeah, some GI upset can certainly be part of it. Some people have fevers, can feel kind of rotten, like you have some sort of viral illness, which, your body's responding to. That immune system response is coming and making you sort of feel that way, even though you're obviously not infected. And so, it can be an array of things that people feel. And, if you have concerns, the answer is always call your healthcare provider and talk to them about it. But, most people, it's not so bad, but some people feel kind of rotten for a little while.
Yeah, and I'll just say I had a sore arm too, and I just want to say, and just in case Patrick can't go, just a shout out to Andrew. Andy, my arm's healed. I'm ready to go. Don't let my 0 for 4 with 2 interception performance fantasy camp stand in your way. I'm ready to play. Just put me in, Coach. Okay, Jill.
Last question would be for the mayor. That people want to know where and how do you sign up to get a vaccine? Is there a waiting list?
Is there a waiting list, Mayor?
There's quite a wait list, but just go to kcmo.gov/coronavirus, and that can get you to the source that you need. And just make sure that no matter your jurisdiction, usually you can go on a public health website and do that. I will note one thing, that since I mentioned the Chiefs, I'm already getting messages. We will find a way to celebrate them. It will just be done in a safe manner, and I imagine because the University of Kansas Health System has been a big part in making the Chiefs safe, a big part of our reopening strategy. We will probably all talk to each other to find a way to be responsible, but also to make sure that we celebrate our team, hopefully, for a lot more wins along the line.
Absolutely, and we're right there with you, Mayor, so thank you. Hey, before I go to final thoughts, tomorrow we check in with Dr. Mark Steele, the Executive Chief Clinical Officer at Truman Medical Center, Dr. Raghu Adiga, the CMO and Infectious Disease Specialist at Liberty, and Dr. Larry Botts, the CMO at Advent Health, to discuss how things are going in their hospital. So team, Mayor, final thoughts for today?
For the day, keep wearing masks. And also, if you go to a super crowded restaurant or bar and it just doesn't seem right, maybe it's not the place to go on and eat or drink that night. There's still coronavirus that's spreading around. Make sure you stay safe. Things are positive now, but as we said before, a lot of these restrictions will stick around for a while. I won't go too long, but I get this question all the time. My daughter is getting married in May or June. Will the world be perfect and back to normal by then? Odds are no. Right? We will still have this around. So continue to make plans that are going to be responsible ones. And if we all just do it right, we'll make sure that we avoid excess deaths and we'll be in a better place long term.
Mayor, thank you. It's been a pleasure to see you. Sir, you've just done a great job, and we so appreciate how hard you've worked for the city and for the Core 4 and for our area. So thanks again for being on our program today.
Thank you.
Nathan, final thoughts?
Yeah, I guess I would just echo, please keep wearing masks, keep your distance from each other, no crowded indoor maskless gatherings. Those are the ways that COVID spreads, and you never know who amongst you might be vulnerable.
Very true. Hey, here's some cool photos. Yesterday, 80 of our hospital staff volunteered to honor Martin Luther King Day by accepting 6 blessing bags to give to people in need, with an emphasis on giving to the homeless population. Employees who accepted the bags were invited to hand them out to anyone who they may know or they may encounter on their way home, or they knew who might have a need. Inside the bags were a mask, water, snacks, and a message of caring. This is one of our nurse administrative assistants. Her name is Bernadette Uresti, and she's there with one of those bags. Thanks, y'all, very, very much. Hey, as you know, as we enter into what we hope is the fourth quarter of this pandemic, maybe we're still early in the third quarter, this is what we have to do. We can't fumble it away. We can't blow our opportunity here as we're starting to march toward the goal line. What we have to do is keep each other safe and keep each other healthy. Everyone here in this pandemic can be Patrick Mahomes. And the way you can do it is by doing your best, wearing your mask, keeping your distance. Don't go out if you're safe, or ill. Go out if you're safe. Wash your hands. And most of all, remember, there's still no place like home. We're back tomorrow. We'll see you then.